Good afternoon, ladies and gentlemen. Welcome to my channel, Science is Life. So today we'll be looking at pharmacology, under which we'll see anti-malarial medications. So, malaria is caused by a protozoan parasite called plasmodium, and plasmodium is of four main species capable of causing harm to man. We have Plasmodium falciparum, we have vivax, we have Plasmodium ovale, we have Plasmodium malariae. So these are the four main species capable of causing harm to man. Now, before going into the anti-malaria medications proper, we'll be looking at the life cycle of malaria, because understanding the life cycle of this Plasmodium parasite will help us to better understand the mechanism of action of the different anti-malaria medication and at which stage of the life cycle of the Plasmodium parasite does this different anti-malaria medication perform their activity. So let us go through the different life cycle of malaria. So the life cycle of malaria takes place in two distinct hosts. We have man. Man is the intermediate host. So we have man. We have man, which is the intermediate host, and we have the female Anopheles mosquito, which is the definitive host. So the two main hosts is man, which is the intermediate host. We have man, which is the intermediate host, and we have the female Anopheles mosquito, which is the definitive host. Now, the life cycle of malaria takes place in four phases. The first phase is the pre-erythrocytic, the schizogony. The second is the erythrocytic. The third is gametogony, and lastly we have the exoerythrocytic phase. Now, for the pre-erythrocytic phase, it occurs when the female Anopheles mosquito bites a healthy human. So an infected female Anopheles mosquito will bite a healthy human, and now the Plasmodium parasite will be found in the saliva of this infected female Anopheles mosquito, which will be transmitted to the human and will move directly to the liver of the human. Now, in the liver, the sporozoid will affect the cells of the liver. So the sporozoid will affect the cells of the liver, and now the sporozoid will be converted to merozoid. So that phase is called the pre-erythrocytic. It means before the erythrocytic phase. So pre-erythrocytic occurs in the liver, where sporozoids are converted to merozoids. Now, after the pre-erythrocytic phase, where the merozoids are released from the hepatic cells of the liver, the merozoids will now move into the blood vessels and will attack the erythrocyte, causing the erythrocyte to rupture. So in the erythrocytic phase, the merozoids will give rise to merozoids again, which will cause the erythrocyte to rupture. And now rupturing of this erythrocyte will give us the signs and symptoms of fever. So we know fever is one of the main signs and symptoms of malaria. So it is the rupturing of the red blood cells in the erythrocytic phase of the Plasmodium life cycle that will give us this fever, and the fever is periodic. So when I say periodic, meaning when let's say we have red blood cells like that. So these red blood cells are infected with merozoids. The merozoids will rupture the red blood cells and will have free merozoids in the bloodstream. These free merozoids will attack another red blood cells, which will cause the red blood cells to rupture again, and the process will continue. So each time these red blood cells rupture, we have fever in the patient. So the fever is not continuous, it's periodic. So when the first group of red blood cells rupture, it causes fever, and the fever will finish, and now you have fever again when another set of red blood cells are being affected and they are ruptured. So that being said, that was the erythrocytic phase. Now moving on to the gametocytic phase, where we have the production of the male and female gamete of the plasmodium parasite in blood. This production is responsible for the transmission of the parasite from an infected man to a healthy mosquito. So take note, the production of gamete is done in man, but the fertilization does not take place in man. Fertilization takes place in the mosquito. Now we'll move to the next phase, which is the exoerythrocytic phase. This exoerythrocytic phase is responsible for relapse. Relapse is the resurfacing of the malaria after a long period of time. So considering that I have had malaria parasite for some time and I have been treated completely. Now relapses come in place when this malaria parasite have been in the liver for so long, so the sporozoid some of the sporozoid stays in the liver and now resurface after, let me say, 1 year or 2 years, 3 years, and start causing malaria again without the bite of the female Anopheles mosquito. So we call that process relapse. We call the process relapse. So we call it relapse when you have resurfacing of the malaria parasite after a long period of time. So we'll look at a brief diagram that will explain properly the life cycle of the malaria parasite. So remember, we started with the bite from an infected female Anopheles mosquito. So when the female Anopheles mosquito bite a healthy human, they will inject the sporozoid, because the sporozoid is the infective form of the plasmodium parasite. This sporozoid will enter into the human body and move directly to the liver. And now in the liver, we will have the pre-erythrocytic phase, where the sporozoid will affect the hepatic cells of the liver and they will give rise to merozoites. These merozoites will rupture the hepatic cells of the liver. Now when the hepatic cells rupture, we will have the end of the pre-erythrocytic phase. So when the hepatic cells rupture, we have the end of the pre-erythrocytic phase. Now here is the pre-erythrocytic phase, where it takes place in the liver, and this pre-erythrocytic phase is responsible for incubation period. So in the pre-erythrocytic phase, we have incubation period. Now when this merozoite rupture the hepatic cell, they move directly into the blood vessels and they will attack the red blood cells. Now in the red blood cells, this merozoite will give rise to trophozoites, new trophozoites, and this new trophozoite will give rise to schizons, and schizons will give rise to merozoites again, and this phase is called the erythrocytic phase. So this phase is called the erythrocytic phase, where the merozoite will rupture the erythrocyte in the bloodstream. So in this phase is responsible for clinical feature, where we have fever. So when periodic fever, because let's say for 48 hours, 72 hours of fever, depending on the species of plasmodium parasite in the erythrocytic phase. Now from the erythrocytic phase, we'll move to the gametogony phase, where we have the production of the male and female gametocyte. Now the male and female gamete will be produced in the red blood cells, in man, but fertilization will not occur in man. Fertilization occur in the mosquito. So when this male and female gamete are being produced in blood, a healthy mosquito, will come and bite the infected human and will now carry the male and the female gamete. Now in the mosquito, the male and female gamete will fertilize, producing zygote, ookinase, oocyte, and finally sporozoites, which will be transmitted by the female anopheles mosquito to another healthy human being. So this is the gametogony phase. Now the last phase we have there is the exoerythrocytic phase. The exoerythrocytic phase, which is responsible for relapse. The exoerythrocytic phase is responsible for relapse. Now, here, dormant sporozoites in the liver, which has been there for long, will give rise to hypanozoites. So the dormant sporozoite will give rise to hypanozoites. These hypanozoites will now go into the bloodstream and start causing malaria again after a long period of time, say 2 years, 3 years, or 4 years. And that is the exoerythrocytic phase. So, hoping we have understood, let us see a comprehensive diagram. So, here we'll be looking at the life cycle for better understanding. Now, notice here we have the mosquito, which will insert the sporozoites. You see the two yellowish dot there is the sporozoite which will be infected into the human. I will move directly to the liver. Now, in the liver, it will affect the hepatic cells of the liver. So, it will affect the hepatic cells of the liver, now giving rise to merozoites. So the sporozoites will give rise to merozoites and causing the rupturing of the hepatic cells of the liver. All this process is responsible for the incubation period in the liver. So that is the pre-erythrocytic phase. Takes place in the liver. Now, when the hepatic cells of the liver are being ruptured to release the newly formed merozoite, this newly formed merozoite will attack the red blood cells. So you see, this is the arrow which will attack the red blood cells, causing it. So in the red blood cells now we have merozoites which will give rise to more merozoites, causing rupturing of the red blood cells, which is responsible for clinical features. So it's responsible for clinical features. So the erythrocytic phase is responsible for clinical features, causing periodic fever. Now we have also the gametocytic phase, where gametes are produced in the bloodstream of the man, but fertilization does not occur in the bloodstream of the man. So see, you have the male and the female gametes. So you have the male and the female gametes there, which will be taken by the healthy female anopheles mosquito, which later on fertilization will occur in the female anopheles mosquito, which will permit transmission. So this gametogony phase is responsible for transmission of the parasite from an infected man to a healthy mosquito, which will later be transmitted to a healthy man. So that being said, hope we've understood the process of infection of the life cycle of plasmodium. Now let us look at the last phase, which is the exoerythrocytic phase. The exoerythrocytic phase takes place in the liver, where the dormant sporozoites, which have been in the liver for so long, will give rise to hypnozoites. Now, these hypnozoites will relapse. So this phase is responsible for relapse. It will cause relapses where the hypnozoites will go back into the red blood cells and start causing malaria after a long period of time. So the fourth exoerythrocytic stage is responsible for relapses, and this stage is most common with plasmodium vivax. So that being said, that is what we have for the life cycle of the plasmodium parasite. So this is a summary. So we said pre-erythrocytic stage takes place in the liver, and in the pre-erythrocytic stage, sporozoids are converted to merozoites. And try to guess the pre-erythrocytic stage, what is it responsible for? I said the pre-erythrocytic stage was responsible for which feature? Okay, the pre-erythrocytic stage is responsible for incubation period. Now, moving to the next, the exoerythrocytic stage, which will take place in the liver, where sporozoids will be converted to hypnozoids, and we said it is responsible for relapse. So the exoerythrocytic stage is responsible for relapse. And now we have the erythrocytic stage. The erythrocytic stage will be responsible for clinical features, correct? So the erythrocytic stage will be responsible for clinical features, while the gametogonic phase, which takes place in blood, will be responsible for transmission. So the gametogonic phase is responsible for transmission of the parasite. So that was a summary of the different phases of the life cycle of the plasmodium parasite. Now, based on the different stages of the life cycle of plasmodium parasite, we have 4 main classes of drugs. So these are the type of drugs according to the stages of the malaria life cycle in which they affect. So the first one is prophylaxis. Prophylaxis will act at the pre-erythrocytic stage. So prophylaxis will act at the pre-erythrocytic stage. We have prophylaxis. Now, prophylaxis will be responsible for the preventing the sporozoid to convert to merozoid in the liver. So prophylaxis will actually prevent the conversion of sporozoid to merozoid in the liver, hence preventing the appearance of clinical features, the onset of the erythrocytic phase. Now, in the erythrocytic phase, we have the curative cure. In the erythrocytic phase, we have the curative cure, which will prevent the conversion of merozoids to merozoid again in the bloodstream. So we have the clinical curative. The clinical curative will take care of the erythrocytic phase, while prophylaxis will take place in pre-erythrocytic phase. Now, radical cure will take care of the exoerythrocytic phase. Radical cure will attack the exoerythrocytic phase, which will prevent relapses of the hypnozoites to cause malaria in further future, while gametocidal will take care of the gametocytic phase, which will prevent transmission. So gametocytic phase will prevent transmission. So these are the different phases at which the different drugs affect the life cycle of the malaria. So let's say a patient comes to the hospital and the patient says, I'm living in an endemic area for malaria, So I would like to have a drug that will prevent me from having malaria. What the doctor will prescribe is prophylaxis. So prophylaxis will be prescribed to the patient, so it will prevent malaria for the patient. Now, if another patient is in the hospital, the patient is showing the signs and symptoms of malaria, and he meets the doctor, what the doctor will prescribe is the clinical curative. Clinical curative is responsible to prevent the rupturing of red blood cells. So this clinical curative will prevent rupturing of red blood cells by stopping the conversion of hemoglobin to hem and finally to hemozoid. So clinical curative stop conversion of hemoglobin to hem and stop the conversion of hem to hemozoin. Okay, there's no space here. Hemozoins. So that is what clinical curative is responsible for. It will stop the conversion of hemoglobin to hemozoids in red blood cells and preventing the rupture of the red blood cells. Now, if another patient comes and the patient says, "Okay, doctor, I have had malaria for some time and I've been cured, but I want to prevent that malaria from reoccurring after a long period of time," the doctor will give the patient radical cure. Radical cure will prevent relapses of the malaria by inhibiting the conversion of the sporozoites to hypnozoites in the liver. And we have gametocidal. Gametocidal is actually for the benefit of the population, because it will prevent the transmission of the parasite from one person, from an infected person to a healthy mosquito, which the mosquito can now go and infect another healthy person. So gametocidal are mostly for the benefit of the population. So that being said, hope you have understood the different drugs and the different stages at which they act. So we have a brief diagram. This diagram will show us the different drugs and the different stages in which they attack. So we have the mosquito which will bite. So remember, in that phase we saw the bite of the mosquito, which the spores will move to the liver, and in the liver we'll have the pre-erythrocytic phase. So we have the bite of the mosquito. The mosquito will bite the man, and the sporozoite will move directly to the liver. Now when the sporozoite move in the liver, the sporozoites will be converted to merozoites in the liver, and this is the pre-erythrocytic phase. Now from there we will have the merozoites in the liver now will move to the bloodstream. Now in the bloodstream we will have the merozoites, which will now be converted to merozoite again and will cause rupture of the RBCs. Now rupture of the RBCs will have the erythrocytic phase, which is responsible for clinical features. Now from there in the RBCs, merozoites will be produced. So merozoites will be converted to merozoites again, and gametocytes will be produced. The male and the female gametocytes will be produced. Now that male and female gametocyte will be transmitted from the man to a healthy mosquito. So let's say here another healthy mosquito will come and bite the human, and it will take the gametes again. So it will take the gamete and it will be transmitted. Fertilization will occur in the female anopheles mosquito, which the mosquito can then transmit the parasite to another healthy human. Now, seeing the different stages, we have the last stage, which is the exoerythrocytic stage, which is responsible for relapses. You see here some of the sporozoids stayed in the liver. Now they can cause malaria after a long period of time, so it's responsible for relapses. Now notice here we have different drugs that will act at the different phases. So here we have different drugs. Now we have drugs that will act at the pre-erythrocytic phase. These drugs will be known as all the drugs that will act at the pre-erythrocytic phase. We will call them prophylaxis. So prophylaxis are drugs that will act at the pre-erythrocytic phase. So for prophylaxis we have primaquine, proguanil, and tetracycline. They will act at the pre-erythrocytic phase and they will stop the conversion of sporozoids to merozoids in the liver. So they will stop conversion of sporozoids to merozoids in the liver. So prophylaxis will act at the level of the liver. Now we have drugs that will act at the exoerythrocytic phase. We call them radical cure, which will inhibit the conversion of sporozoids to hypnozoids in the liver and prevent relapses. Now we also have curative cure. Curative cure will act at the level of the bloodstream, which will prevent conversion of merozoids to merozoids. They will prevent the conversion of merozoids to merozoids and will also prevent the clinical features from occurring. So it prevents fever, prevent the rupture of red blood cells, will prevent ruptures of RBCs. So, and we also have the gametocidal. The gametocidal will act at the level of the gametes, so they will prevent the formation of merozoids to gametocytes. So we prevent the formation of merozoids to gametocytes in the bloodstream, hence preventing transmission of the parasite. So that being said, those are the different drugs that will act at the level of the life cycle of malaria parasite and the different stages on the life cycle. Now for the drugs that act at the erythrocytic phase, we can separate them into two: the fast acting and the slow acting. So the drugs that act at the erythrocytic phase can be separated into the fast acting and the slow acting. For the fast acting drugs, so the doctor will most likely give the fast acting drugs to the patient rather than the slow acting drugs. So for the fast acting drugs, we have amodiaquine, we have halofacine, we have chloroquine, we have quinine, we have atovaquone, we have artemisinin, and so on. And for the slow acting, we have pyrimethamine, we have sulfonamide, we have proguanil, and we have tetracyclines. So those are the different separation of the drugs in the erythrocytic phase. Now in the gametocytic phase, you can see in the gametocytic phase we have the primaquine, chloroquine, and the quinine, which will act at the gametocytic phase. So these are the drugs which act at the gametocytic phase: primaquine, chloroquine, and quinine. And in the exoerythrocytic phase, we have primaquine. Notice, primaquine acts both at the exoerythrocytic phase and the gametocytic phase. So we'll be looking at individual drugs. So for the individual drugs, I will do just 4 of the individual drugs, while you guys will go and make your research and come out with the other drugs. So the first individual drugs we'll be looking at here is chloroquine. So the first individual drug is chloroquine. So we have chloroquine. Now chloroquine, who can guess where does chloroquine, in which phase of the life cycle of malaria do chloroquine affect? Chloroquine will affect the, which phase will chloroquine affect? Is it in the pre-electricity phase? If you see here, there's no chloroquine in the pre-electricity phase. There's no chloroquine. Is it in the exo-electricity phase? No. Is it in the gametocity phase? Yes, we have chloroquine in the gametocity phase, and we also have chloroquine in the erythrocytic phase. So chloroquine will act both at the erythrocytic phase, and the gametogony phase. So that is where chloroquine will act. So in the erythrocytic phase, chloroquine will prevent the rupturing of the red blood cells, while in the gametogony phase, chloroquine will prevent the transmission of the parasite. Now for the mechanism of action of chloroquine, we will have chloroquine will prevent the conversion of hemoglobin to hemozoins in the red blood cells and prevent rupturing of the red blood cells. So let's say we have the cytoplasm of the man and we have the parasite inside, and this is the food vacuum of the parasite. Now the malaria parasite, what happened in the blood, how it functions is this malaria parasite converts hemoglobin to hem and finally to hemozoin. This hemozoin that causes rupturing of the RBC, of the red blood cells. So now what chloroquine, let's say we have chloroquine here, chloroquine will enter into the food vacuum of the malaria parasite. It will increase the pH. Of the malaria parasite, thereby preventing the conversion of hemoglobin to hemozoid. So hemoglobin will now be converted to hem. And now free hem is toxic. In the environment. So now what will happen is this free hem will cause the rupturing of the malaria parasite, of the vacuum of the malaria parasite, and now what will happen is the malaria parasite that will rupture, but the cytoplasm of the human will stay intact. So that is how the chloroquine function in the mechanism of action. Now what are the adverse effects of chloroquine? The adverse effect of chloroquine, we will have rash. So you can have rashes in your body, all over your body. You can have rash. You can have also ototoxic effect. Now ototoxic effect has to do with your hearing. You can have hearing impairment, deafness. So that is ototoxic effect. We can have myocardial depression, and we can have hypotension for the side effect of chloroquine. Now we'll look at the next drugs. We'll take mefloquine and quinine at the same time. So we have mefloquine and quinine. Mefloquine will act at the erythrocytic phase, and mefloquine is a fast-acting drug that acts at the erythrocytic phase. Now it has the same mechanism of action like chloroquine. So it will prevent the rupturing of red blood cells and conversion of hemoglobin to hemozoin. And in quinine Quinine also acts at the erythrocytic phase and is a fast-acting drug. The mechanism of action, it will also prevent the conversion of hemoglobin to hemozoin. So that being said, we've come to the end of this lesson. So subscribe, like if you have not done that yet, and so you can have the update of our new videos. Thank you for your time and your attention.